So this is a unique type of format called the Unified Health Simplified webinar. And the purpose here is essentially to begin to have open discussions and conversations about what's really happening in the healthcare industry, but predominantly focus on how is it that we get to support my colleagues out there, the doctors out there, to be able to basically navigate, and I'm going to be very kind when I use this term, interesting environment that we currently live in the medical space. And so my background is I'm a plastic and reconstructive surgeon, also nominated for the Nobel Peace Prize. And I don't normally actually share that part. But the reason I bring that is that is the underlying theme of all the things that I've been doing, basically from a decision I made when I was 21 years old. And interesting enough, it was after I watched a movie, a 1979 movie of The Warriors. And if anybody has seen that movie, it was about the gangs in Coney Island and the kind of values that they needed to adhere to. But what struck me more than anything else was the simple fact that they were so marginalized and disenfranchised, and they were fighting for their own survival. And I feel in many respects, so are we as doctors or health practitioners, including all types of non-conventional practitioners. We're all fighting for our survival. And the truth of the matter is it's really all of our fault. And I'll go more into deep depth into that. And so my personal mission, and it's something that I've been working on very clearly and intentionally for the last 22 years. And finally, because of the ecosystem that I recently joined, which is the Sean Calicky and Unblinded group, of which Laura is also currently a part of, is to lovingly disrupt the current healthcare model by delivering a democratized and unified model where every stakeholder has a seat at the table and wins. And what that really means, or translated, is to make it ridiculously easy for anyone to optimize their health by giving access to information, tools, resources, and people, and most importantly, making it really affordable. But this is where everybody really wins. So it's not a zero-sum game. It's really a matter of, where is the merit in all this, and where can people really benefit the most in order for, these practitioners, these very well-intended practitioners, both conventional medicine and non-conventional, to be able to serve their communities at best possible level. Because the current situation is in crisis. And what I really mean by that, well, the truth of the matter is that when we compare the health situation with 11 other industrialized countries, the United States actually ranks last. And even though we're spending twice as much as any other country, but we rank last as far as quality of care and the effectiveness of the delivery of care as well. So this is a major problem. And there's a lot of things that we can unpack for all of that. But I really don't want to focus on that way too much. But I think giving context to where doctors are today, I think is relevant. Because oftentimes as physicians, we like to put on the blinders. And we put on the blinders simply because we're so dedicated and committed to our calling. And we have become very resilient. We've become very tenacious, basically because of all the, training programs that we underwent. And so for us, it's almost like a badge of honor. Okay, we'll just deal with this stuff. Well, that's precisely the wrong attitude that we should have. And quite frankly, many of these institutions, and we'll talk maybe a little bit more about that later on, have really taken advantage of that. And so this webinar series is really part of the Doctor's Guide podcast series. There's also the Prescription for Your Transformation, as well as the Masterclass Fuel, where I help doctors reimagine the business of medicine and helping them get in the driver's seat, getting back in the driver's seat of their practice. And so for today, what we'll do is before or after I give it a little more context of what's really going on in the medical space, I'm very excited and honored to be introducing 3 other speakers. And the idea here in this webinar series is that we're not selling anything. But we're just sharing information as to what are some of the things that you can begin to address. Because one thing that I've discovered, as a busy practitioner, is we don't always have the bandwidth to be able to curate and verify and validate all these different options. And that's essentially my job as the doctor's guide, is essentially, curating and validate different people, different products, different services. I'm doing the homework so that you don't have to do that. And it's entirely up to you what it is that you decide to do with all of that. And at the end of this webinar, I will offer I'll give you an offer. Again, it's not a sale, but it's an offer for what's called a business acceleration session. So you're going to want to wait till the end for that, because that is that opportunity that I can help you explore where are some of the leakages or friction points in your business, and how I can potentially make some, very beneficial connections for you as well. And so I'll be talking for another, say, 6 or 7 minutes, and then I'll pass the baton on to somebody else. So the real healthcare crisis, as seen by doctors, and including what is talked about and what is not, and oftentimes what is not even realized by many of my colleagues out there. And so when we really put everything in that context, I mean, one of the key issues that doctors are facing today is basically loss of autonomy, loss of purpose, loss of satisfactions, as doctors are really governed by all these different restrictions and requirements and quotas. And really, I mean, it's a hostile environment, for all of us. And so the challenge then is that with all these restrictions and limitations, it's really difficult to be our best in any kind of clinical situation. And guess what? The consumer, the client, I don't call them patients anymore, they know that. In fact, a 2020 study was illustrating how many patients were just simply unwilling to go to the doctor because of lack of trust. And then, of course, we've got the overburdening of other issues like EHR, administration, IT, concepts like outmoding. Outmoding is a concept where you begin to incorporate technology in your business, and then it's outdated before you even know it. And then the cost involved for that. And then, of course, the time and effort to relearn new things as you need to upgrade. But the other part, which is very alarming, is the punitive actions that are happening, from our colleagues, from institutions, for things that, are just absolutely insane and also inane. And I've had my own personal experiences with that, and maybe there's time for that story later on, but where I was accused of doing something wrong when somebody simply didn't understand what it was that was really happening, made an assumption, and really tried to get me into trouble. And we were really actually quite upset when they couldn't find any fault in anything that I did. But here's the other alarming fact. When you look at the last 10 or 20 years, as inflation constantly increases, obviously, and our reimbursements are being reduced anywhere between 8 to 10% year over year, there's a gap of over 60% of revenue loss because of the inflation and the loss of reimbursements. And that's alarming, and that's making it harder and harder for doctors to thrive in the business. In addition to the fact that everything is getting more expensive, the ability to get quality staff is also becoming much more difficult, mainly because other institutions or bigger practices have the ability to leverage more so than the individual practice. And interesting enough, basically in the 1950s and 60s, I think it was easily 70 or 80% of physicians had their own private practice, and now it's the exact opposite. And according to some, that's been a Medicare directive over the last 20, 30 years. It's not something that I verified, but to get every single doctor out of private practice. But then you have all these mergers where you have like Walgreens and CVS, buying out insurance companies. And so that's also further reducing the quality of care as people are also being replaced. So finally, when we look at doctors, I mean, they're not well equipped to run the business. And we say that jokingly, right? But the truth is that most of us don't. And that begins to be another problem as well, because there's a lot of redundancies, loss of revenue, a loss of opportunities. And so, again, if you're listening to me and understanding all these different situations, whether they relate to you or not, or if you're familiar with them, you'll begin to realize that, yes, we have a major problem, and we need to start looking at things differently than we have done before. The final part that's also alarming is the lack of support from the community of doctors. We see our colleagues out there more as competitors more than anything else. And that's kind of, how we train during residency. As much as we think we're collegial, the truth of the matter is it's really not that so. And so our real competition aren't our colleagues. The real competition is everything out there in corporate America and legislation and everything else. So what's clear is that we don't have effective revenue models. And that's one of the things that I discuss in the master class. That's the purpose of this webinar too, to bring in new revenue models. In fact, on the next webinar on July 11th, for those doctors that do a lot of out-of-network cases, especially those surgeons like orthopedic surgeons and neurosurgeons, there's millions of dollars that we are able to reclaim through medical revenue recovery. And that's, so if you're interested in that, definitely, sign up for the July 11th. So finally, the other part is the lack of awareness of current trends in medicine and wellness, and how non-doctors are actually eclipsing doctors in managing public health and wellness. And over the last 20 years, we've seen incredible resurgence of all this technology that actually was available, starting basically from Tesla himself. So much technology then, so much science then, that's validated, valid, that will be the future of medicine. And these are things that I'm actively looking at in the terms of bioenergy technologies. We talked about that last time. Great breakthroughs. And again, more importantly, it's that opportunity for doctors to offer more value to their patients. So why all of this right now? I'm going to wrap it up in about 2 minutes, and then I'm going to give the mic back to Laura. And the purpose is this, is that, I recognize that we definitely have a problem in this country, and it's actually worldwide. And with all the new technological advances, there's great opportunities for all of us to be able to adopt a new way of the practice of medicine. And this is a new kind of conversation that we all can have. And so it's helpful then to then begin to collaborate with other types of resources that will be able to streamline our business, whether it's revenue models, whether it's retaining any kind of money that you earn, and having the best advisors help you with that, dealing with any of the legal issues, and of course, marketing and all these different elements that, are part of business. But the key issue here is that we need to educate ourselves at the highest level, so that we are then able to direct those people that will be working for us, rather than abdicating that role to somebody else and hoping it's going to work. And so again, the purpose of the webinar is to give you new tools and resources. My job then is to connect you with either those people on this webinar today, or any of the other webinars, or any of the other people that I connect with, as you and I have a conversation as to what is actually happening in your business, how can support you. And again, that's an offer that I give you. There's no charge for it. We're not selling anything yet. I'm here to give more value than I'm ready to receive, because it is my passion, it is my mission, and I'm here to help out my colleagues out there. So I want to introduce Laura Ciclari. She's a lawyer for medical and social services practices, a trusted advisor and partner, helping clients limit risk, manage their people and HR processes, and provide daily healthcare best practices and guidance. And she'll be discussing the most common HR and people management issues for medical practices. She's an amazing human being. I've had the opportunity to have many kinds of conversations with her. She's also part of the Unblinded group. And if you don't know about that, hang out after this webinar, 8 o'clock. There's a great webinar coming up. Laura, the mic is yours, and thank you for joining me today.
Thank you, Bart. And thanks for everyone who came today. It's great speaking with a group of doctors. I'm based in New Jersey, and my practice is nationwide though. So I'll talk about a couple of things. Having spent 20 years as an employment lawyer, and being in the unique position where I'm able to offer a really unique subscription billing model to medical practices, as opposed to, hourly billing, which kind of takes the worry away of contacting your lawyer when you need to. So being in that position where people aren't worrying about what my bill is because they already know, I get lots more frequent and proactive calls, and I'm able to do a lot more day-to-day business counseling for medical practices, social service practices like mental health addictions. So in that practice for 20 years, there's definitely some common, I would say, employment law type issues. I group them under the employment law bucket that I would say I do tend to see over and over again with medical practices, which I thought it would be helpful to go over a few of those things today and help save some of you from some future headaches. So the first issue that I often see is doctors not maintaining their employee files with the same, I would say, diligence that you do a patient file. So doctors are very cognizant of getting their electronic health record completed, entering their billing codes, because if you don't, you won't get paid, or you're not going to have as easy of a time defending your quality of care if there's ever a future malpractice issue. So doctors are well aware what they need to do to keep their patient file completed and up to date. But I will often see doctors not have that same level of attention to detail with their employee files. And that really can end up being a mistake and costing you a lot of money and heartaches in the end. And that's because um, you may get some poor performing employees, for example, or somebody who's habitually tardy, or is, calling out sick unexpectedly, or just not performing their job duties. It's often easier because you're busy, you're all busy doctors. It's sometimes easier to just not confront the issue, to not take the time and put a written performance evaluation together, to, let's say, follow up a verbal reprimand in an email. The problem with that is then later down the road, when you're looking to actually terminate an employee, or let's say you've already terminated the employee and the employee is making a claim against you for wrongful termination, it's a lot harder to prove that there were performance issues all along if you have not been papering your employee file as you go. And it's really not that difficult. You know, Annual performance evaluations should be done. It's easy to get a form and to put that together and to put that evaluation in the file. And you should be honest on those. There's nothing worse than hearing that somebody is a poor performing employee for years and then getting a copy of their employee file and they're getting 5 out of 5s in all categories year after year in their employee evaluation. You can't support the case there's a performance issue if you're not backing it up with demonstrating that you have raised employee issues with them timely. People calling out sick, being late day after day to the point where you give them a warning. Maybe you give them a warning verbally, follow it up with an email, put a copy of the email in the file. These are all the things that you can do to put together an accurate picture of how this employee has performed over time, so that, again, if you have an issue down the road with termination, you have the backup for it. So that's a really important thing to do, but one of the most commonly things that physician and medical practices don't do. A second common issue is mishandling an employee's injury or illness when they are looking to go out on a leave or to ask for accommodations. Being in the medical world, doctors, I would say, are more sympathetic than many types of other employers about making sure that your employees feel supported and cared for when they have medical issues. However, your desire to help them must also be balanced against the fact that you still need to run a business. And especially if you're running a small business and you only have several key employees, having one of your critical employees want to go out on leave or to ask for accommodations really can be crippling for you. So you really need to be aware of what your obligations are and aren't under the law. For example, Federal law, the FMLA, the Federal Medical Leave Act, it's federal law that provides employee protections, but it doesn't apply to all employers, for example. You have to have at least 50 or more employees, okay? And the employee at issue who's looking to go out on leave has to have been working for you for at least 12 months for a certain limited number of hours. So if somebody has just started working for you within the past few months, and maybe they're only part-time, they only work for you, once or twice a week, um, they're not gonna qualify for FMLA protection. And that's important because what FMLA, when it does apply, requires you to protect that employee's job unpaid, but for 12 weeks. That means you have to hold their job open for 12 weeks. Okay, that's a long time if you're going to be really short-staffed with this employee gone. So it's important to make sure that the law even applies to your business. If you have under 50 employees right off the bat, that law doesn't apply. Now, granted, depending on what state you're in, there are state medical, like New Jersey has the New Jersey FMLA. Some of those do provide more protections than federal law, so it's important to know if you have a companion New Jersey or other state law that applies to you. But again, these are all important things to know. Another law that comes into play when somebody is looking for accommodations or looking for some kind of a disability leave is the ADA, the Americans with Disabilities Act. Okay, that's another federal law. That law kicks in when you have 25 or more employees. But the kicker with that one is the employee has to have a qualified disability. So they can't just have the chronic flu and they're out for a couple of weeks and they're looking for an accommodation. They must have a permanent or systemic injury or illness. Cancer would qualify. Physical disabilities that are permanent would qualify as long as they impact one of your major life activities. Now, that's important. If it does apply to you, then you do have to offer an employee accommodations if they need them, as long as the accommodation that they're asking for is something that your business can reasonably do without providing an undue hardship for you. So, for example, let's say you have a delivery driver and you do at-home medical delivery services. And this delivery driver, as an accommodation, said, he needs to have a desk job and can no longer perform deliveries. Okay. If that person's job, if one of their essential job functions was to deliver medical supplies for you, for example, then it's reasonable for you to say, I'm sorry, we're not able to accommodate you, because the accommodation of what I'd be giving you would basically change your job duties completely. Like, you would no longer be performing the essential job functions that you were hired for. And that law, that exception of the law, this undue hardship, is a very important exception and protection for employers, because it makes a difference between you having to just agree to anything an employee asks for and being able to weigh it against what your business can actually handle without it really crippling your business. So these are, all very, very important factors that come in when you have an employee who is sick or becomes disabled on the job. A third point that I wanted to make, and remind me, Bart, how am I on time? I don't want to just start.
You got about another 4 minutes, so you're good.
Okay. I could go on all day
I know.
about this stuff. I love this stuff, but so I really had a hard time narrowing it down to like the top 3
You're
issues.
doing amazing.
But another issue I often see would be for small medical practices where your office manager is also your bookkeeper, is also your chief HR director, and you really have somebody in a role to manage your employees who really doesn't have that level of training. They kind of fell into it by default. So, they're wearing multiple hats, and there's nothing wrong with being the CEO slash, chief bottle washer, especially when you're building your business. But at the same time, there are certain triggers that happen in the employment context that if you don't have somebody in place who knows what those red flags are, or who knows the way to legally respond to an employee complaint, you could be setting yourself up for a problem down the road. For an example, an employee comes to you, not you as a doctor, but comes to you, whoever you've designated as your, your HR director in quotes, and says, hey, I feel like I'm being discriminated against. I feel like I'm being harassed at work. What I will often hear in response, which makes me cringe, is the person, maybe a coworker of theirs. So they treat a complaint like that very informally, and they'll say, well, you've been here for years. That's just how Dr. Jones is. You know what? He's under a lot of pressure. He blurts out things he doesn't mean. You know what? You just gotta, you gotta roll with it. You gotta, not be so sensitive if you're gonna work here. Wrong answer. It's absolutely the wrong answer. Number two, you get somebody in a role who, again, is taking on this HR function, who also is a friend to other workers and really doesn't understand the role that they're playing when they take on being the person that employees will bring complaints and grievances to, because employees expect a certain level of discretion and confidentiality when they're coming to you with an issue. And if your HR person doesn't really understand that that's the function that they're playing, they may find it very juicy gossip in the lunchroom to talk about, well, do you know, so-and-so came to me, don't say anything, but, and then they proceed to really expose all of an employee's, private discussions that they've had. All of these issues really can create a problem down the road if an employee makes a complaint. Okay, so it's important for whoever is in this HR function for you to know the difference between somebody just not liking the job or not liking the environment versus somebody who has a legitimate EEO issue. An EEO issue would be, anything that involves a protected class, for example, sexual harassment, a racial issue, a gender issue, gender identity issue, a sexuality issue, disability issue, national origin, basically all of the protected classes that we know of. If somebody were to raise an issue triggering one of those things, then your HR person needs to know to treat that very formally. And in most cases, with a very small office, I would recommend that in order to prevent any allegation of bias, that you turn an investigation like that over to an outside attorney to handle that investigation.
Well, this is amazing information, Laura. And the truth of the matter is that as doctors, we spend all of our time really focusing on the practice of medicine. It's very intense, it's very involved, it's very deep, it's very granular. And so, with our commitment, we kind of have this kind of sense of, well, we're so committed to do the right thing, then I'm guessing that everybody else is going to do the same. And that's not the
100%.
case. And so the problem is that we just kind of ignore all these other elements that are critical that can, cause us lots of headaches. I've had those headaches in the past, totally surprised, totally blindsided by many of these things. And so clearly, having these kinds of insights and at least having a conversation with Laura, for at least to find out where some of the gaps are is really, really key. So I'm going to want to hold off any kind of questions till the very, very end. What I'd like to do is introduce my next speaker, and that is Roberto Roman, a dear, dear friend of mine. I asked him, okay, tell me a little bit about you so I can tell the rest of the world. His humility and genius are amazing. The guy is a genius, incredible strategist, doing some fine work with me on a major project that I'm working on. But his humility is just amazing. So Roberto, I'm gonna let you take over for the next 12 minutes. Tax strategist, teaching businesses and individuals how to spend smart money.
Hey guys, welcome. Thank you for attending. A little bit about me. My name is Roberto Roman. I've been doing this now, crazy to say, for 25 years. My father had a tax practice in the 80s. I followed his footsteps, essentially the short version of it. I love what I do. I love people. I love making sure you don't pay a dime extra than you have to the IRS, for that matter, to anyone. And what I'm looking forward to do is just tell you some things that a lot of people overlook, pretty much applicable to whether you're self-employed or employed, any business, any sector, if you have a side business. So I'm just gonna touch on a few things, as well as I'm not planning to go too deep into the strategy, just a high level. But as I'm sure most of you are aware, the tax code is complex. There's a lot of things you could take advantage of, assuming you know you're speaking to the right people. So the first area I want to touch on that most people have or have access to but don't take full advantage of is a 401k. Essentially, it's a retirement account. Um, some high things to speak about. If you're under the age of 50, you're able to deduct 23,000. A lot of people that they aren't aware of, because it did change a few years ago, is the fact that there is a 401k Roth option, which is an after-tax option, which is extremely beneficial depending on, I won't spend too much time on it. If you're looking to accumulate wealth, it's pretty much a way you could pay taxes now and no taxes to whatever it grows to in the future. So if you're under 50, it's 23,000 for 2024. It's constantly adjusting. If you're over 50, it's 30,500. The other area that I would like to touch on, which is pretty much not applicable to the employed people, but the self-employed people, is when I speak to a lot of clients, they're like, "Hey, I'm maxing out my 401k." Like, all right, how much are you contributing? It's like 23,000. What a lot of people don't know is the employee's portion could be 23,000 up to 23,000. That's the max for 2024. But you are allowed to contribute to the max, which is including the employer. You are able to go up to $69,000. So if you're self-employed or have a small business, or for that matter, a large business, it is something that I always tell clients to explore, because you could take it's a way you could take grow wealth as well as reduce your tax burden depending on what your overall goals. I'm pretty much always focused on what's the client's goals, what's best. It's not one size fits all. There's so many things that you could do. It's what's your goal, so I can help you achieve your goals by reducing your tax burden. So moving on, other area that a lot of people speak on and know about is Roth traditional IRAs. There are backdoor Roths for those that don't qualify for Roth IRAs. You could do a backdoor Roth. I won't get into the nuances regarding how you do it, but there are ways you could get money into a Roth IRA through a backdoor Roth if you don't qualify due to income limitations for a Roth IRA. The next area I want to touch on is the pretty much HSAs. You being doctors, health saving account. Sometimes doctors don't know about what's available to them, so I'm just going to touch on it at a high level. It's a health savings account. It's available as long as you have a high deductible healthcare plan. Contribution limits are, if it's self only, it's $4,150. If you're a family, it's $8,300. What are the benefits of it? It's pre-tax contributions, it grows tax-free, and tax-free withdrawals, assuming it's used for medical expenses. What a lot of people don't know about this is, one, it rolls over year, so you could continue to compound the growth. The other area that people usually don't know about is the fact that you could invest these funds. You got to speak to your HSA representative, the company you work with, and assuming that they have certain thresholds. Once you reach the threshold, you are allowed to invest certain funds, which could help you grow your wealth even faster. And if you grow it, if you have your 401k as well as your IRA, you have a health savings account that you don't use and continue to compound the growth. Once you reach 65, you could use that as a retirement play or a estate planning play. There's so many things that you could do regarding that. The next area I would like to touch on is more geared towards the self-employed people, or the business owners, I guess we could say. It's a hot topic. You hear a lot about it on social media, employing your children. I would like to speak on it a little bit more depth, what a lot of people don't tell you. You could employ your child. You're allowed to employ. The benefit of it, but most people take advantage of, that you hear about, if you pay them up to the standard deduction limit, They don't have to pay taxes, and you could take it as a deduction, which is kind of like a win-win. The one thing I want to spend time explaining is the fact of you have they have to do something in your business. You can't just pay them because they're your child. I guess you could, but it's not legal. Let's just say that. A lot of people will say, "Hey, how would the IRS know?" You're absolutely correct. The tax code is on the honor system until it's not. And usually when it's not, they send you a notice, and that's when you need to answer some questions. So to avoid getting there, it's always just better to do it on the up and up from the beginning. So you pay your child. A lot of people come to me and say, like, what could I pay them for? I'll give you an example. I like to use my personal situation. Since most clients share so much about their personal situation with me, I like to share some about my life. So I have two kids, 5 and 2. People like, hey, are your kids on payroll? Yes, I have my own business. My two kids are on payroll. They're like, how can you justify your son, 2 years old, being on payroll? Well, he's a model. They were like, huh, that's interesting. He's a model. I take pictures with him, put him on marketing efforts, do all this stuff, and pay him a royalty for using his picture. And they're like, huh. So there's a lot of creative ways that when you work with the right people and you think outside the box, that you can make certain things that you think are impossible possible. And it's all about
I
keeping
told you
as
he was
much
a
money.
genius.
I swear that
It's
was
all about
like a mic drop moment. I had no idea you were going there with that.
yeah, it's one of the things that a lot of people don't think about. It's just like, hey, how can you do it? Hey, if your kids are cleaning the office, if your kids are taking out garbage, it's little things that they could do that you could pay them. And the benefit, what a lot of people don't think about, is the benefit that the money needs to be used for the child's benefit. So what does that look like? Hey, if you're paying your child $13,000 a year and you go on vacation, hey, you need to pay for their tickets separately through their funds. All right, it's little nuances. People like, hey, I really don't want to do that, but if it's saving you money on taxes, it's worth it. And a big thing that people don't think about is the fact, one, once they have earned income, which you're paying them, they would have earned income. You could set them up for their life for retirement. You could put money in a retirement account for them and change your family's trajectory after you. It's all about, at least, I can't say it's all about. My belief is I want to leave my kids in a better situation than I'm at. My ceiling should be their floor. That's my belief. I don't want to push it on anyone, but that's pretty much where I'm coming from. The other area is a lot of doctor clients that I have, they have their kids in private school. It's like private school is not tax deductible. You have your own business, you could pay your child, and since it's not a necessity for their well-being, school is, but not private school, because it's not a necessity for their well-being. You're allowed to pay them out of the funds that you pay them. You could pay them out of the funds that the payroll that they receive, and it's kind of like a back-end way to get the tax deduction. So obviously, it's important to work with the right tax professional because there are little nuances that you need to stay compliant. That's the only other thing I would mention. But essentially, what that is, that's the income shifting strategy. The hope is that you're in a higher tax bracket, your child's in a lower tax bracket. Hopefully, you stay under the standard deduction that is a zero tax bracket, and you're paying 20, 30%. Your child's paying zero. It's staying within the family. It's all about keeping the funds in the family. At least, once again, for my family, that's the way I operate. The next area that I would like to touch on is pretty much leveraging tax efficiencies. There's different things that you could do that you could take advantage of to accumulate your wealth. Another area that I do have, I am fully investment licensed, so I will touch on investments.
We have
benefits
about
of using.
2 minutes left. Okay, Roberto, is that okay?
All right. Yep, that's fine. The next area, the next and final area, the next and final area is pretty much municipal bonds, tax-free interest. You could touch on loss harvesting through capital gains to offset your gains. There's loss harvesting that you could do. Consider tax efficiency mutual funds, ETFs. there's definitely a lot of things out there that you could take advantage of. And the one area with the time we have left that I would like to touch on is private foundations and donor advised funds. There are ways you can make contributions into a tax deductible account, and you could pretty much still control the funds and where you want them to go for future use, and takes a contributional deduction in the tax year where you make the donation. So there's a lot of things out there. Fortunately, time flies. You think you're going to speak on so much. I have so much things prepared for you guys, but I'll leave it there. I look forward to, once again, thank you for your time. Look forward to speaking with you, those that reach out. God bless, and I'll turn it back over to Bart.
Well, and just as brilliant as Laura as well. I mean, Laura was amazing what you shared, what you're sharing with us here. Roberto was absolutely amazing. I knew Jude is already signing up his beautiful kids as employees, as they are amazingly beautiful. I know Barry has a question. We'll keep that question till the very, very end. So my next guest, and this is a great story for me, because as I share the colors on this slide, you'll see it's the green and the blue and the orange. Fun fact, it actually cost me $20,000 to hone into these colors. And the reason being is I hired a company out of Britain, beautiful artistry, beautiful stuff, but they just did not comprehend my market, who I was, my identity, and everything else. And after spending about $20,000, I just finally had to fire them. And so in most is exasperation, trying to find out other people, work with another company, dear friend of mine, brilliant guy, also good stuff, but just didn't hit the mark until I met Ed Gelb. This is the first time I've had a website that I'm so incredibly ecstatic about. And so I definitely recommend everybody to look at that because it really is in alignment with everything that I am. So Ed Gelb, Vanguard Online Marketing, creates extreme exposure and authority for clients online, maximizing growth and elevating business with targeted results and driven strategies. So Ed, the floor is yours till 6:55 as we go into the next phase.
Well, thank you. I will tell you that is why it took so much time to get Bart to trust me, because I was just another marketing guy out there saying what everyone else says. And I kept saying, try this, try this. And after I showed him some of these things, it was boom. And we just nailed it, because we do a lot of like emotional intelligence mastery marketing. We really want to get into what it is that people want and need. And what I do really is just take people, my clients, to higher levels, get them to be seen and known by their potential clients so they can make money and build their practice or business. And I will say, Laura, right in my area, there's only 20,000 attorneys, right? I'm down here in Miami. And I think, Roberto, you're down where I am also, aren't you?
I'm in the Fort Lauderdale area.
I'm
Okay.
frequently in Miami. Hollywood Beach is my spot.
Okay, there you go.
So I'll pretend to be partially from Miami.
That's okay. So anyway, what I want to tell you is I have information that can really help you. And I do have doctor clients, as you see. And what it does, it changes their practice and their lives. And that's my thing, just like Laura said, she loves what she does. Roberto loves what they do. I have a gift. I am so grateful to God that I'm able to express and do what I do every day. It's just the most fun because it has so many facets to it. It has business, it has math, it has calculations, it has design. Everything has to do with online marketing. It's just ever learning, doesn't stop. I actually study Google every day for hours. I study it. I belong to four different international SEO groups. Everyone hears the word SEO, they think, oh no, another marketing guy. We really go in and study it to the granular level to really understand what it takes to take any client, to understand them, to get them out in the world. It's so much more than just putting together what people call keywords and content. There's so much more to it. It's about math, understanding formulas, understanding what's called entities. So what I thought I would do is explain basically how SEO and online marketing works. And I'm happy to actually answer any questions at any time. And the way it works that people just don't really understand is it's all driven by code. And this code, as you've heard before, is called HTML or JavaScript code. And what it does is these actual, Google sends out what's called these actual spider bots, and they crawl the code and it sends signals back to Google about whether that information is good or not. And it compares your information in a database. Google's just a big database. In the database, comparing to your competitor or to any kind of related information, it takes that and compares it to that. And if you answer the query the way that Google wants to hear it, you will be sent higher up in the Google rankings, which is called the SERPs, or search engine results pages. And so that being said, by setting up your coding correctly and setting up the website correctly with the right coding, the right formatting, there's something called on-page SEO. There's something called off-page SEO, which I'll explain. And what I do is when I put this together, doctors, and I want to tell you, by the way, Bart, I have a client here in Coral Gables now. He said he wanted to go international. He's been with me 6 months. I have words that he's asked for that are ranking in St. Lucia, ranking in Costa Rica, all over the world. He's a global guy. And just by doing what I do with formulas and so on, I thought this is so perfect for you to hear, because it's really just putting him out there with what he needs. People will be calling him and giving him business, just like I want for you. And by doing this with doctor clients that I have here, it's so powerful because the website, they have the information. Example, functional medicine, I'm getting to the top of Google, and they are just getting calls, and the practice is just growing and bubbling because of all the things that we're putting together for them, which is so exciting. So there's a lot to it. It's SEO, it's video marketing, it's content marketing, email marketing, it's creating awesome, massive content, and I explain all these kinds of things. And anybody has any questions, I'd be happy to even answer them now, if you have questions about what it is that you
Well,
do.
we'll wait with the questions till the end. So just
Okay.
you have like a few more minutes, unless you're ready to wrap it up, and then we can go to
Oh,
the next.
that's fine. What I just want to really make clear is that what Google really asks for is that you become what's called an entity. It's not SEO anymore. It's really called entity SEO. So Google wants to know without any shadow of a doubt at all that you are the exact entity that they're looking for certain kinds of questions of how to grow your practice or your business, who you are compared to anybody else. If you are identified with the right kind of formatting on your website, right kind of information is called in terms of content. We use things like NLP or natural language processing. We actually go out to the internet world, look for the best performing content, take that information and use it for our clients. And with that, we can grow the website so it's just spot on. Every single piece of the website has information that we want, that Google's looking for. Crawling it, and then when your clients come in, they read it and understand it. They love it. They want to contact you and call you. I do this for attorneys. I do this for doctors. I do this for all kinds of people here. And it just works. It's a lot of fun, and it's profitable for everybody. So that's pretty much what I have to say for this. And I'm happy to answer any kind of questions in terms of
Okay, great.
SEO.
No, that's amazing. And just to give a sense of, this is my website, and I traditionally don't like to show my face that much, but apparently it's the way it's put together. It's so incredibly appealing. But one of the key issues that Ed was able to dial into is a congruent uniqueness. And so rather than competing with all the other people doing the same thing and trying to be louder, how is it that you can be congruently unique, which then creates a lot of curiosity. And so that's what we were able to do on this website. And interestingly enough, the challenge was quite complicated because I'm not just a plastic surgeon. I'm here for an amazing, global impact. And so what they also created for me was all this content. And I thought I was pretty good at writing stuff, and really blown away with how they were able to capture all my work in a language that I feel is very, very relatable, very inspiring, very aspirational. And so the work again that Ed has done on the front end, basically with the website, as the entry point, as the portal to say, okay, great, I'm interested in this person. And the back end, of course, all the links and the SEO connections and everything else, it's just really kind of mind blowing. And so recognize that he is definitely an artist, and very much appreciate, what he's doing for me. I'm going to shift right now. So you see the new paradigms, right? Yeah. So the final thing before we go into the last part, one of the key concepts that we need to recognize as physicians is the new paradigms that are out there, because the new paradigms that have been created by all the people outside of conventional medicine are really breakthrough technologies that will save all of our practices, save our lives, give us the autonomy that we desire, but more importantly, keep us in the game as we saw the game was supposed to be, and with the autonomy and our ability to serve our clients in the best possible way and with what it is that they need. And interesting enough, when you have 50% of the adult population that is looking to be healthy but don't have a professional guide, and they're not finding it with our colleagues out there. So looking at new paradigms, one of the obvious ones, and I talked about this last time, I'm just going to share one or two with you, is the bioenergy technologies out there. And so the real thrust in the changes of the health and wellness environment started back in the 1980s. If some of you are old enough, you'll remember Jane Fonda in the gym, developing then into wellness, developing then into regenerative medicine. So stem cells is a big player these days. A lot of confusion on that part, but it's also something that trained doctors as well. I got involved in 2009, but the real shift is going to be bioenergy technologies. And I'm not going to spend much time on that, but if anybody's really interested in finding more about that, then they can contact me. We'll do a business acceleration session. We'll talk about that. Plasma light, so many technologies out there. A lot of it is actually not quite up to snuff. And so it's important to find someone like me that can help you create or understand which are the best technologies. But this is a beautiful technology in the world of health optimizing. It's also about stacking up technologies together. And this group has actually stacked up hyperbaric with different types of technologies, vibration, sound, scalar technologies, light technologies that are really impacting major shifts in how the body is functioning and potentially actually reversing disease. Obviously, we can't make those claims that easily. So what I want to do a shout out right now before we go into the question and answers is simply this, is that I'm very passionate about this platform. And because I feel for my colleagues out there, I've been fortunate as a plastic and reconstructive surgeon. It's also, fee for service, so not dealing with insurance companies. But most of my colleagues have to deal with insurance companies. They have to deal with quotas. They have to deal with, pencil pushers, standardizations, loss of quality of care, loss of, quality of life. And so the one thing that I want to offer is that opportunity for me to have a complimentary session with you. And we call that a business acceleration session. It's not a concept I created. I have to give credit to this amazing man, Sean Callaghy. And if you haven't heard about him, just look him up from Unblinded. But it's really to connect with you and explore, okay, where are some of the ideas that will benefit you? Where are some of the gaps, where are the leakages, where are the friction points? And I'm happy to give you some ideas that you can move forward. If I can make some connections with any of the people here today or any of the other resources that I have, happy to do that, not expecting anything in return. That might seem weird for people, but that's how we do things. So there is a business acceleration value at $7,500. There's some also bonus material. You'll get a brand audit from Ed. Laura will also have a way to consult with you regarding whatever it is that you're doing. And the same thing with Roberto. And this is intense value. They're putting a lot on the line for that, for you. They're doing me a favor, but they're amazing people, big hearts, and wanted to support you as well. You can do hit that QR code with your phone. And then just register for that. And then the first couple that obviously sign up, there's additional bonuses as well. So I'll keep this up for just a little longer. I'll leave it up for the end as well. Any particular questions? I know Barry you had a question. If you want to unmute yourself, something about children, adult children. I'm not quite sure I understood your question. Are you going to unmute, Barry, or?
Can you hear me?
Yeah, we can hear you.
Okay. Uh, Roberto brought up the idea of paying your children, and and he gave the example of a minor child. My question was whether you can pay your adult children.
Well, the best way to answer your question, yes, it won't have the same benefit that it would be if they're a minor. But I also like to add, you could pay anyone that's dependent on you in a lower tax bracket. It's essentially an income shifting strategy. So if you're paying someone that you already support financially, whether it's a mom, dad, child, you could do that, and it shifts the income out of your tax bracket, which is usually higher, to lower tax bracket, which is usually theirs. Now, if it's a child, if they're under the age of 18, they're exempt from Social Security, Medicare. Let me rephrase that. If it's set up the right way, they're exempt from Social Security, Medicare, federal unemployment, state unemployment. If they're over 18, unfortunately, they're not exempt from that. Does that answer your question?
Yes.
All right,
Great.
awesome.
I have a couple more questions, and then I'm going to give the mic to Dr. Kane a little bit. He's got some also very interesting technologies out there. And that's also the opportunity on this webinar to be introducing other people that are not necessarily speaking, but have something of value that they can offer others as well, and I'll help make those connections. So what do I do? This is for Laura. What do I do about court orders demanding that I release patient medical records?
Okay. So that is something that often I see in practices that involve pediatric issues, children. I see it with mental health practices as well. So if I understand the question, it is where a practice receives a court order that, as part of the order, requires the practice to turn over certain records about a patient, and these are medical records or medical treatment notes, for example. So for those who don't know, HIPAA, which is our federal law that protects health records, does have an exception for court-ordered releases of records. And then those court orders negate the need for a consent document to be signed by the patient before the records are turned over. The only caveat I would give is to make sure that you are only providing the specific records that are prescribed in the court order. For example, if they're asking about a certain date of service, it would be inappropriate and outside the scope for you to turn over that entire employee's years of record, for example.
Awesome. I have one more question for Ed, and then one back for Laura in a moment. So there's always this debate about which social media platform you want to focus on. I've got my thoughts on that, but kind of curious, what are your thoughts on that?
Well, I will tell you, for everybody, no matter what practice or business that you're in, the best one to have is YouTube. YouTube, any kind of video going forward in the future is going to be so powerful. And if you just take very easy videos of yourself speaking just into your iPhone and you upload it to your website, it's so powerful. When you optimize it, you will be seen on YouTube itself, and you will be seen across many different venues. You want to create something called omnipresence, and just that's probably the best one. That Facebook and Instagram and LinkedIn are the best platforms to use.
Yeah, and it's the personality, right? I think nowadays, unfortunately, with doctors, we seem so reserved, we seem so professional, all this kind of stuff. But the reality is that the more personable that you are, the better the exposure. And I love, Dr. Jude, who's on here. He's got such a great personality and such charisma that if he's not doing something on video now, he better start, and I'll kick his butt if he doesn't. But he's got this amazing presence, and people want that. People want that connection. They want the relationship. They want to develop the trust. And that's one thing that, we have been trained on, because we come from the place of, well, we should know everything. We've got the confidence, we've got the competence. That should be enough. But the reality, it's not. And I could go on forever on that one. Another question for Laura. What if an employee asks for disability accommodations that we can't do for them, like working remotely?
Okay. That is incredibly common right now, post-pandemic. Everybody wants to work remotely if they can, or many employees do. The problem is that not all jobs can be done remotely. And the mere fact that an employee claims they need to work remotely because of a medical issue does not mean that you as the employer have to agree to that if the employee's job can't be done remotely. That would be the biggest reason that you can say that it would be a hardship for your employee. And if if the medical support, like if the medical letter doesn't really document why, what's the connection between their disability and working remotely? For example, if somebody has some kind of a chronic back issue and they can't be lifting heavy things, and they say, I need to work remotely. Okay. The answer is you could give them a light duty job in your office. There's no need that just because they have a chronic back issue that the only accommodation you can give them is the specific one they ask for. If you can give them an alternative reasonable accommodation that works better for your business, you can feel free to do that. So the answer is it's a collaborative process, but you are not held hostage by the employee. You have the right to think through what they're asking for and whether it's something that can be done within the scope of their job duties. I hope that makes sense.
Yeah, no, it makes perfect sense. I'd like to give Dr. K an opportunity for about 3 minutes to describe what he has. When I talk about new paradigms, one of the things that is a key message point of what I'm teaching doctors to think differently, and that is data. And so we're not utilizing data in the way that is best suited for us to be able to optimize people's health, because essentially what we're doing is we're getting static information like lab tests, like vitamin levels, nutrient levels, make your microbiomes, which actually are very good and very helpful up to now, but they only give us inferences of what's really happening in the body. And so what's very exciting with the work that I do is I'm bringing technologies from all over the world into the United States that allows us to get information at a cellular level. And once we get that information at a cellular level, now we actually are talking about what's called root cause. And I kind of laugh a little bit because everybody's throwing that word around or that phrase around loosely, saying, well, we're just do these lab tests and we do this. Well, that's not the root cause. That's just an inference of where there's a potential imbalance and a potential sequelae of that imbalance. But root cause is understanding at a cellular level. And there's so many, and one of them that I'm really excited to share with you is with Dr. K. So you have about 3 minutes with that, Dr. K.
Okay, appreciate it, Bart. I'm holding up what is called a biophotonic scanner. You can see how small it is. This will be able to tell the physician exactly how much carotenoid levels are in the person's cellular level. And that lets us know if there is proper bioavailability of the foods that they eat and the supplementation that they take. And there's no other thing like it in the world. It's globally patented, and they can tell that patient immediately where they stand in comparison to where they should be. So that's kind of the nuts and bolts of it. And it was the size of an MRI machine when we began. Now it's this size. It's validated by 110 peer-reviewed studies. And we are listed in the physician's desk reference with the supplementation that we use to change a person's scanner score and improve their health at a cellular level. So that's basically what the biophotonic scanner does.
Oh, awesome. Does anybody have any questions in regards to that?
I do. I'm a non-physician, but I'm curious, Dr. K, if a physician were to get that piece of equipment, how could they, use that in conjunction with their other, medical practice?
Great question. We're looking for biomarkers. In other words, the patient is examined, they have their blood pressure taken, and they might do a blood test for cholesterol. But what about the cellular biomarker that tells how well they're absorbing the nutrition? So it could be part of the initial examination, reevaluations, reexaminations. It only takes 30 seconds, and it's viable and it's immediate, and it will look back about 45 days of the patient's health and see what they are like when it comes to their lifestyle. I call it the lifestyle lie detector, basically. So it can be integrated in any practice, very inexpensive, and a great way to create another revenue stream for the physician.
You're going to find us all being liars. Oh no, that's terrible.
That's absolutely true.
So that would be an add-on for a patient where they wouldn't necessarily go through insurance. They would pay out of pocket for that, but it would give them a really good snapshot that they wouldn't otherwise be able to get.
Well, exactly. 80% of the populace in the United States takes a supplement of some kind, and we find out 95% of them don't absorb at a cellular level, so they're wasting their money. So this would give the physician the idea right away of their biomarker for their cellular wellness, and they could instruct the patient on what they need to do with their lifestyle and supplementation to improve their biomarker. And it's guaranteed to improve that in 60 days, or a person gets their money back.
Yeah, just to reframe exactly what Dr. K is saying, this is all the work that I'm doing because there's so many technologies, but this is such a beautiful one right now. And that's simply this, is that as physicians who are, super specialized in their particular area, they're losing out on the opportunity to actually helping their patients or clients, maximize the work that they're doing and optimize the work that they're doing by making sure that their body is assimilating the right kind of nutrition. Because without the proper nutrition, it doesn't matter what kind of medical treatment you're instituting, your body's still compromised. And we just have to assume right now that all of our bodies are compromised with all the toxin levels, the exposures, the stress, everything else that we are faced with on a day-to-day basis that we now actually take for granted. And I kind of joking say, all the conveniences that we have created for ourselves through technology has become extremely inconvenient, because now so many people are sick, and 1 out of 2 men are getting cancer, and 1 out of 3 women are getting cancer. And there's a reason for that. And so one of the easiest ways to begin to make some changes, and I actually always start with my patients with a DNA profile, first thing, because that tells us how our metabolic pathways are actually going to work. And then, of course, okay, let's see, how our body is assimilating the nutrition. And so this is not the only one out there. There's many, many out there. But for a doctor, this is also a great revenue model, because the practice is very, very affordable. Getting one of those tests is $35. And when you think about it, you invest $35 in a test, and maybe do that several times throughout the year to understand, how much, how well you're doing with any of the changes that you're making, as you then consume different supplements or change your nutritional behavior such that you're upgrading the assimilation into your cell, and therefore you're going to be a lot healthier. And so that's the key. It's the data that we don't utilize, that we monitor over time. I think you, Laura, have heard this thing, tracking and measuring and monitoring. I think that's something in the Caligy group they keep on hammering us on. That's what we need to be doing as physicians. And it's a very easy add-on. The investment for this device is minimal. And then in addition to that, you get access to all these different supplements. But again, just to full transparency, I do believe that getting that DNA test is really important first, because now you understand how your metabolic pathways are working. Because as an example, my personal case, let's say if my vitamin D levels were low, and we can measure that, the fact of the matter is, if I take large amounts of vitamin D, it's not going to work because of my genetic profile. And so that's why it's an important component. And the way my genetic profile manages vitamin D3. And if you remember, when we had COVID, everybody was telling you, take vitamin D3 and take B12 and do this, and vitamin C and everything else. And I was taking 3 capsules of vitamin D every single day, only to find out that I'm only able to process 1/10 of it at any given time. And that's just my DNA. And so that's why this kind of information, the data, and again, that's the major narrative that I'm doing with all the work that I'm doing is, we got to get the data. So I hope it's a long-winded answer, Laura, but it's not just for you. Any other questions? Any else you want to add? Laura, yourself, anything you still felt you wanted to share that you didn't share? Then I'll go with Roberto and Ed. Or any questions?
No, the only thing I would say is that, if you ever have an inkling that something isn't right with an employee issue, or you think you're being set up for something, don't be afraid to call a lawyer. It's much better to get one involved sooner rather than later. Don't be afraid of calling a lawyer. I mean, if it's the right lawyer, they will truly be a strategic advisor for you. So it doesn't need to be where you just call the lawyer after you get hit with a lawsuit, because many times you can avoid things like that just by making some proactive changes to your business.
Yeah, and I've been working with Laura for quite some time, and she's part of a beautiful ecosystem with the highest integrity. And so I would absolutely recommend, if you have a question, do a consult with her. Her programs are amazing. And so definitely, and it's worth your while. I mean, that kind of investment is definitely so important, because you've invested so much time and money, and it's so easy to get sidelined by this nonsense that too often is happening in our world today, basically because too many people are suffering and they're struggling in life. And we see malpractice lawsuits, skyrocketing only because, people are struggling financially.
It's the same with employees, and employees have certainly become savvier, I would say, post-COVID. And they're looking for a way to get a quick buck and to do as little work as possible. Not all employees, I'm not meaning to generalize, but it's certainly an uptick in what I've seen. So, all the more reason.
And with that in mind, again, I made the grave mistake thinking that my team was in alignment with all my amazingly genius ideas, only to find out that they weren't. And that's actually part of the masterclass fuel that I have, is helping doctors relate to, what is a team? What are the rules? What are the criteria? What is a culture? These different elements that we just simply don't think about. And I can guarantee you all these other, quick fix management programs out there are not teaching you either. They just have a standard procedures, their recipes, but they're not exactly in alignment with who you are as a physician. And then you also obviously get a lot of coaching from me. Ruperto, anything you want to add?
The only thing I will add is, since there was a few questions regarding paying your child, minor, adult, I would definitely say, just if it's not me, make sure you speak with the professionals, because if it is set up the wrong way, you will have to pay the tax. The way I was speaking about to avoid FICA, which is Social Security, Medicare, federal unemployment tax, state unemployment tax, it needs to be set up a certain way, because we do have S corps out there, we have LLCs, and all of them have their own nuances. So sometimes they need to be set up separately to get the cost benefit savings. That's the only thing I'll add.
Great, awesome. Ed, anything else you
Yeah,
want to
sure.
add?
Yeah, the last thing for me is to say that if you are really looking for your practice or your business to actually grow and be seen, fix your website. Is what people look at. It's how they judge you. It's what the whole world perceives you as a professional. So I would seriously consider that. It's a great tip for you. So I would just do that. That's my tip.
Yeah, and to that point as well, I was holding back in a lot of the work that I was doing for several years, in fact, because I didn't have my front page, and I was just being led down the wrong path. Not with any malintent, it's just that they didn't get it, and so very fortunate. So Ed, has a great team, totally dialed in on both the front end and the back end. So definitely. So I want to wrap it up. I'm just going to show the QR code once again for anybody who wants to sign up. I highly encourage that. Even if this is the replay, definitely reach out, because I'm blessed with all the training that I've gotten through the Unblinded Sean Callaghan ecosystem to understand integrous human influence and creating impact at the highest level, as we all need that today. Because the truth of the matter is that as professionals, particularly as doctors, we have this huge responsibility. By 2030, we'll be short of 100,000 doctors. That's the estimation. With all the changes, with all the changes in our culture, and I'm just going to leave it at that, that's happening today, which is just insane. We need to step up as physicians, have the courage to say, look, no more. We are going to retain our autonomy. I'm sharing with you resources that will allow you to do that, and all perfectly legit. And so that gives you the ability to not only thrive, to pay off all your debts, by the way, even if you're, starting off, fresh out of, residency, or perhaps part of an institution and just fed up of what's happening there, and wanted to go out in private practice. And so we need to turn the tables again. 70% of all doctors are within private practice. This is a problem because other people are telling you how to practice. And we saw that during COVID. And now, unfortunately, fortunately, however you want to slice it, we're seeing all the data coming back, how so many of those things that were caused were just wrong. And I'm not that kind of person that will be able to discuss any of those, because I don't have those insights. I leave that to somebody else. But the truth of the matter is, as scientists, as doctors committed to the health of people, we need to do a much better job. And the answers are not just in conventional medicine. So I'm not knocking conventional medicine. It has a very important place. It's got a long history of dedication and commitment. The truth of the matter is, there are other solutions out there as well that we need to know. And the most basic one actually is nutrition. And as physicians, we don't learn about any of that. And now we've got the tools. And it's a matter of getting those tools and collaborating with other doctors or other practitioners and offering more value. And at the same time, understand this is a business. And so you can collaborate with others and get referrals and get commissions. It's all part of doing business. That's what all the big corporations do. They're really clever. It's time that we began to do the same. So I want to thank all of you. Any final words for anyone, more than welcome. And I'm happy also to connect with anybody. I will reach out to everyone and do a business acceleration session, totally complimentary, helping you navigate the complexity of the world today, as I'm lovingly disrupting the current healthcare model. Any final comments?
No, thank you for what you do, Dr. Bart. I mean, it's incredibly important. Thank you.
Thanks for having me on.
I wanted to share real quick as Dr. J. I just want to say thank you for the invitation and the presenters. I've got little nuggets from each one of you, super, super important. And thanks for Dr. Bart as usual, and for lighting a little fire so I get myself video, putting things on video, and we'll definitely look at YouTube. So thank you guys.
And Dr. Jude is an amazing human being, a beautiful soul. And he's the kind of doctors that we need to support and guide and everything else. He's also part of the ecosystem of the unblinded. And I will definitely have him on this stage relatively soon, just to have him share his experiences and be a guide for others. Because as a doctor, you're an amazing person and will be able to guide many others to do the same. So thank you for those comments, Dr. Jude. All right, I think that's a wrap up. And just once again, my personal mission, it's started off when I was 21 years old. It's a humanitarian mission based on the movie The Warriors in 1979. Just go check it out. It really hit my heart when I realized these poor young adults so disenfranchised, and we need to do something about it. Fast forward today to lovingly disrupting the current healthcare model, where to deliver a democratized and unified model where every stakeholder has a seat at a table and wins. That means everyone, including the pharmaceutical companies. I mean, they're doing a lot of great work as well, but everybody else too, making it ridiculously easy to optimize your health by giving access to information, tools, and resources and people, and making it affordable. Thank you. And one last thing, we will be back on July 11th. And that one is about medical revenue recovery, bringing breathwork as an adjunct into practice, big time in wellness today, and then implementing regenerative medicine now. So once again, thank you. And this concludes this webinar.
Bye.